Alhamdulillah, salatu wassalam ala Rasulullah. Today we are talking about the why pediatrician should be available during the delivery. So many families have seen they are not comfortable with that. One of the reasons is that they haven't paid the pediatrician without no reason. But it's very vital that the pediatrician should be available. So let me tell you a few examples that I already discussed that pregnancy induced hypertension or gestational diabetes, or their problem with the cord. So all these stuff are prolonged labor or they're being stuck and there is a chance of having infection. So all these reasons are there so that child specialist should be available for that. And even if there's no complication with the baby and everything is good, still he should be seen by the doctor or pediatrician. So if you can imagine, the vital things are that his heart rate should be normal, and their lungs should be normal so they can breathe easily. But as a general checkup, they see on multiple things in a baby. First, they want to make sure that the vigorous cry is there, his posture is good, and color is great. All these things, what they do, it tells them how healthy the baby is. So if you are to do the head-to-toe exam, they go and check the head circumference to know that there is no pathology, and then they check the anterior frontal area to see that there is not an abnormality of the brain. So if you come down, they assess the eyes, they assess the mouth, they put a finger in your mouth to see the soft palate that is intact. And coming down, they try to see if there's any trauma to the small bones, and they see the range of movements for the arms and legs. And then they can examine the heart, and many times some findings can be found which were not living before that. Similarly, they check the function of the lungs and see its expansion, and after that they try to see the problem with the abdomen, whether there's any kind of hernia or there's any problem with the liver or spleen, they may be lost due to certain reasons. And sometimes these intestines can go through into the lung area and can cause problem or stress to the lungs. And similarly, if you keep going down further, they try to see all the joints at normal range and they are well. At the same time, they check the girdle of the hip. So they should make sure that the bones or the femur should be in. So they check the girdle of the hip and want to make sure that the femur's head is into the other bone, the hip bone. So make sure that all the joints are normal. And further, in the genitalia of the baby, they want to make sure there's a normal genitalia, or there's a bladder opening, the urethra, is it normal size? Similarly, the bowel opening, is it abnormal or there is any problem in that? And further down, they try to check the thighs and legs and make sure that the fingers and the toes are intact in numbers. And after that, they can give you final assessment that what baby is going to do and how you work in the future and what is the prognosis regarding that. So please make sure that our pediatrician should be around when a baby is delivered. Thank you very much.